Hello friends, myself Dr. Rupesh K. Gautam, Associate Professor at Department of Pharmacology, Edina Institute of Pharmaceutical Sciences, Sagar. Today we are going to learn an interesting chapter of B.Pharm at semester on current global trends in nutraceuticals, their types, raw materials, quality control and assurance, regulatory affairs and commerce in nutraceutical and their significance in the prevention and treatment of diseases. The chapters are divided into following modules. Module first, that is nutraceutical in general. Module second, that is current global trends in nutraceuticals, their types, raw materials. Module third, nutraceuticals, quality control and assurance. Module 4, regulatory affairs and commerce in nutraceuticals. Module 5, nutraceutical and their significance in the prevention and treatment of diseases. Let's start with general introduction of nutraceuticals. Module first, nutraceutical in general. Nutraceutical is a term coined in 1979 by Stephen DeFalis. It is defined as a food or parts of food that provide medical or health benefits, including the prevention and treatment of disease. Basically, nutraceuticals means nutritive plus pharmaceutical, a food stuff that provides benefit in health. Nutraceuticals may range from isolated nutrients, dietary supplements, herbal products, and diets to genetically engineered designer foods and processed products such as cereals, sops, beverages. A nutraceutical is any non toxic food extract supplement that has scientifically proven health benefits for both the treatment and prevention of disease. Nutraceutical also refer to natural, functional, and medical foods or bioactive phytochemicals that have health promoting, disease preventing, or medicinal properties. These nutraceuticals in general contain lipids, minerals, vitamins, proteins, carbohydrates, or other necessary nutrients depending on their emphasis. These nutraceuticals are used in nutritional therapy based upon their chemical structures and biological functions. The other components of our definition of nutraceutical include the statements for disease treatment and prevention and administered with the intent of improving the health and well-being of animals. When a dietary supplement, nutraceutical or other feed is intended to be used for the treatment or prevention of disease, in essence it becomes a drug. Now we are going on module second, that is current global trends in nutraceuticals. The increasing acceptance of plant derived products in the market is major driver for increase in market for phytochemicals and plant extracts in future. With increasing health concern and alertness regarding the benefits of plant derived products, the consumer in developed nations such as US, Germany, etc. are leaning towards these products for securing health and protecting body from various diseases. Continuous focus of research and development towards plant derived nutraceutical ingredients is resulting in progress in the field and increasing applications. As the current market scenario portrays that the plant extracts and phytochemicals have gained importance in the personal care industry with range of herbal products entering into the market. The concept of cosmeceuticals is emerging with personal being served to the customers as a medicine in order to safeguard them from skin diseases and even the ill effects of the chemically prepared personal care products. The nutraceutical industry lays favor than three main segments which include functional foods, dietary supplements and herbal or natural products. Global nutraceutical market is estimated as $170 billion. In 2007, nutraceutical sale was projected to reach $74.7 billion at an AGR of 9.9%. This assumes a world economic recovery in 2003 and an end to price competition. According to a recent report, the total market for nutraceuticals in India is growing at 21% per annum. It is currently valued at 44 billion rupees but could be worth more than 95 billion rupees in 4 years. As a concept, nutraceuticals is still in its stage of infancy in India, but it has been growing much faster than global rates at CAGR of 18% for the last 3 years, driven by functional food and beverages categories. The most rapidly growing segments of the industry were dietary supplements. Due to imbalance and deficiencies in national medical delivery system, it keeps large number of population dependent on natural and alternative medicines in India. Popularity of Indian Ayurvedic therapies boosts the export opportunities for formulation based on haldi, ashwagandha, ginger, tulsi, etc. Vitamin D will see the fastest growth in demand due to increasing clinical evidence of swine flu, cancer, and other preventive medicine benefits. Global demand for herbal and non herbal extracts is increasing continuously. Green tea for weight loss and cancer treatment, while ginkgo biloba for improving cognitive function has been widely used as nutraceuticals. Glucosamine generates strongest growth in demand due to its usefulness on treatment of arthritis. The nutraceutical industry in the US is about $86 billion. This figure is slightly higher in Europe and in Japan, represents approximately a quarter of their $6 billion total annual food sales. 47% of the Japanese population consumes nutraceuticals. World demand for nutraceutical ingredients were expand about 7% annually to $29 billion in 2014, serving a $236 billion global nutritional product industry. WHO estimates that 60% of the cardiac patients in the world will be Indians by 2030. Asia is expected to have 190 million diabetic cases. More than half of them are in India and China. Scientists say that the percentage of overweight or obese people in India is on track to rise from 9% in 1995 to 24% in 2025. In addition, use of nutraceutical products is increasing continuously because of some alarming facts as walking decreased by 60%, exercise and jogging decreased by 50%, game and sports are recreational activities decreased by 50%. Nutraceutical food or food components that help in treatment and prevention of disease are made from herbal or botanical raw material. This is rapidly growing industry with more than millions of people in the world using these natural products. According to recent analysis from Euromonitor, international global sales of health and wellness products are on way to reach a record of about $1 trillion by 2017, fueled by functional or fortified products designed to offer specific health benefits. The Indian consumers' awareness about conventional nutraceutical ingredients is severely limited, and nutraceutical manufacturers need to take up the cause and spread awareness about their products to the Indian masses. The global nutraceutical market has seen maximum growth in last decades. In India, beverages and functional food are expected to witness much higher growth rates when compared to dietary supplement over the next 5 years. In the Asia Pacific nutraceutical product market, Japan represents the largest consumer, followed by China. India's functional food market is forecast to record moderate growth, with functional foods and beverages forecast to account for almost 71% of the dietary supplement sector in 2070. In Middle East and Africa, dietary supplements represented the fastest growing market segments in the nutraceutical market, recording almost 31% yearly growth between 2007 and 2011. Non-herbals represented the fastest growing segment, while proteins and peptides was the most rewarding market segments in 2011. In Eastern Europe, nutraceutical products market growth is being fueled by expansion in dietary supplements and functional food market segments. Russia represents the region's largest nutraceutical consumer. Hungary and Russia forecast to hold just over 20% and just under 24.5% of the nutraceutical market respectively in 2017. Nutraceutical came into medicinal format such as capsules, tablet or powder in a prescribed dose, while modern nutraceuticals are available as forms of food or include in foods or as whole food itself, such as probiotics, drink and yogurt. There is lack of investment and focus on research and development, imbalance of food provided to the undernourished through government schemes are current challenges. To overcome that challenges, we should encourage research in the field of nutraceuticals by funding, provide research and development infrastructure support to nutraceutical players for conducting research. Also, there should be collaboration between industry and academia and increase public private partnership. Now, module third, that is nutraceutical, their types, raw materials, quality control, and assurance. First, types and raw materials. Nutraceuticals can be ordered in several ways depending upon its easier understanding and applications, such as for academic instruction, clinical trial design, functional food development, or dietary recommendations. Some of the most common ways of classifying nutraceutical can be based on food sources, mechanism of action, chemical nature, etc. The food sources used as nutraceuticals are all natural and can be categorized as: first, dietary fiber; second, probiotics; third, prebiotics; fourth, polyunsaturated fatty acid; fifth, antioxidant vitamins; sixth, polyphenols; seven, spices. First, dietary fibers. These are the plant origin substances present in food which are not digested in gastrointestinal tract and add bulk to the intestinal contents. Examples include fruits, barley, oats, lignin, cellulose, pectin, etc. Generous intake of these fibers in diet is associated with low risk of CVD, hypertension, obesity, diabetes, and colon cancer and gastrointestinal disorders. Second is probiotics. These are live microbial food supplements which, when administered in adequate Those help in improving the intestinal microbial balance of the host, example lactobacilli, bifidobacteria, etc. Their administration is reported to be associated with a decreased risk of allergy, asthma, cancer, infection of ear and urinary tract. Third one is prebiotics. These are the dietary ingredients that benefits the host by selectively changing the composition or metabolism of gut microbiota. These are generally fructose based oligosaccharides existing naturally or supplemented in the food and are not digested by human beings. Examples of such foods are chicory roots, banana, tomato, and alliums, beans, etc. These are found to be beneficial in improving lactose tolerance, detoxification, and dyslipidemia, relief from constipation, and in certain tumors. Fourth one is polyunsaturated fatty acids. These may be omega 3 fatty acids, example alpha linolenic acid, eicosapentaenoic acid, and docosahexaenoic acid found in fatty fishes, flaxseed, soybean, etc. Or omega 6 fatty acids, example alpha linoleic acid and arachidonic acid found in corn, sunflower, and soybean, etc. Fifth one is antioxidant vitamins. These include vitamin C, vitamin E, and carotenoids. These vitamins are abundant in many fruits and vegetables and possess silent oxygen quenching and lipid peroxidation preventing properties. Regular intake of these helps in prevention of a number of diseases. Sixth one is polyphenols. These phytochemicals are produced by plant for protection against photosynthetic stress and reactive oxygen species, example flavonoids, anthocyanins, and phenolic acids. These possesses anti-inflammatory and antioxidant properties and are found in foods like legumes, tea, and soybean, etc. Seventh one is spices. These are ecosteric foods adjunct used to enhance sensory quality of foods. Most of the components of spices are terpenes and other constituents of essential oils. Minute quantities of dietary spices have antioxidant, anti-mutagenic, chemopreventive, anti-inflammatory, and immune modulatory effects. Second one is quality control and assurance. Good manufacturing practice is a term that is well known worldwide for the control and management of manufacturing and quality control of foods, pharmaceutical products, and medical devices. GMPs are guidelines that outline the aspects of production that influence the quality of a product. The guiding principle of GMPs is that quality is built into a product and not just tested into a product. Therefore, assurance is that the product not only meets the final specifications but that it has been made by the same procedures called standard operating procedures under the same conditions each and every time it is made. In the food industry, GMPs address all factors involved in a manufacturing process: personal premises, building machineries and apparatus, documentation and quality control that generally affect product quality or impact quality monitoring. Beside these factors, an important theme that is part of GMP that ensures that facility systems, equipment, processes, and test procedures are under control and therefore consistently produce quality product. This is a special quality assurance method which is explicitly required by GMP codes and mandated by law. Process analytical techniques are now being implemented in the pharmaceutical industry to supervise and control proper operation of these processes. Also in chromatography, fractionating and purification in the food industry such an application is seen. It allows for GMP, QC, better function, better control, higher productivity and on spec production or higher number of on spec batches. Process chromatography is being applied in food beverages and nutraceutical processing. Chromatography has a high resolving power which can give high purity food products. With the initiation of the nutraceutical field, also more expensive forms of chromatography based on affinity may find application as the potential higher sales revenues balance the higher operating costs. Chromatography is a flexible purification method that is likely to play a role in food, beverage, and nutraceutical processing for years to come. Now we are going on module 4, that is regulatory affairs and commerce in nutraceuticals. The primary set of rules governing the nutraceutical market is the Dietary Supplement Health and Education Act DSHEA passed in 1994. The Food Safety and Standard Rules 2011 have been issued. Food Safety and Standard Authority FSSA has also issued regulations with respect to licensing and registration of food business, manufacturing, packaging and labeling, food product standard, etc. Benefits of implementation of FSSA Acts. First, unification of 8 laws such as steps to harmonization. Second, alignment of international regulations. Third, science-based standards. Next, clarity and uniformity on novel food areas. Next is help curb corruptions. The Indian definition as per Food Safety and Security Act passed in 2006 yet to implement. A traditional medicine is not a part of nutraceuticals. Foods for special dietary use are specifically processed or formulated to satisfy particular dietary requirements, which exist because of a physical or physiological condition or specific disease and disorder. These are presented as such where in the compositions of these foodstuffs must differ significantly from the Indian standard. Composition of ordinary food of comparable nature. Government Regulations NLEA 1990, Nutritional Labeling and Education Act of 1990 NLEA defines how food is labeled, including nutritional labeling in accordance with definitions established by FDA, and providing for the use of claims about the relationship between nutrients and diseases or health related condition. Benefits of regulation allows greater legal security and more predictable environment. Next is supports innovation, food and drink products. Next is prevents unfair competition from manufacturers using false or misleading claims. Next is if positive claims cannot be made, the regulation does not oblige anyone to mask negative claims about the product. The Food Safety and Standard Rule and Regulations are effective from August 2011. This act is encouraging manufacturers for product research and development, develop reliable protocols and carry out clinical studies. Foreign Direct Investment Act passed in 2012. That also provide new opportunities for international firms to manufacture and sell nutraceutical products in India. Thus, there is only single authority to regulate production, distribution, and marketing of nutraceuticals in India. Nutraceuticals still need support of an extensive scientific study to prove their effects with reduced side effects. This can be achieved by the enactment of FIM proposed Nutraceutical Research and Education Act NREA. The NREA includes the creation of a nutraceutical commission NUCOM specifically for the review and approval of nutraceuticals and the creation of a nutraceutical research grants program specifically for clinical research. As per FIM, the key elements of NREA should include a mechanism to create the exclusive rights to claims necessary for private investment in research and development and the creation of appropriate channels for the review, approval, and regulation of new products and claims. We believe that in so doing, the NREA should keep in check the cost of nutraceuticals and thereby assure access for everyone. Now we move for module 5, that is nutraceuticals and their significance in the prevention and treatment of disease. The history of nutraceutical dates back to more than 200 years, even though there have been significantly massive wonderful discoveries accomplished in the field of medicine in the past 6 decades. The world recognizes the meaningful and excellent progress with tremendous achievements in the domain of science and herbal medicines, specifically at a very early stage. The well known Indian system of Ayurveda proved to be a main source and provided several techniques whereby many dreadful diseases could be eradicated or cured from a human being. Nutraceuticals are currently receiving recognitions being beneficial in coronary heart disease, obesity, diabetes, cancer, osteoporosis, and other chronic and degenerative diseases such as Parkinson's and Alzheimer's diseases. Evidences specify that the mechanistic action of natural compounds involve a wide assortment of biological processes including activation of antioxidant defenses, signal transduction pathways, cell survival associated gene expression, cell proliferation and differentiation, and preservation of mitochondrial integrity. It appears that these properties play a crucial role in the protection against the pathologies of numerous age-related or chronic diseases. It is very essential that the nutrients found in many foods, fruits, and vegetables are responsible for the well documented health benefits. For example, lutein and zeaxanthin prevent cataracts and macular degeneration. Beta carotene and lycopene protect the skin from ultraviolet radiation damage. Lutein and lycopene may promote cardiovascular health, and lycopene may help prevent prostate cancer. Nutraceutical and some lifestyle diseases as first cardiovascular disease because of the extremely long history of CVD, the causal relationship of nutritional or physical exercise on measure CVD measures is still difficult to measure prospectively. The relationship between calcium and risk of hypertension is inconsistent and inconclusive, and the relationship between calcium and risk of pregnancy induced hypertension. Treatment with beta carotene, vitamin A, and vitamin E may increase motility, There are possibilities to develop nutraceuticals to prevent and manage thrombosis risk in women with thrombophilic gene mutation. Second is obesity. A merge of glucosamine, chitosan, phenugic, G. sylvestri, and vitamin C in the dietary supplement significantly reduced body weight and promoted fat loss in obese individuals. Further studies are needed to establish a long term efficacy and adverse effect potential. There is a very high occurrence of obesity worldwide, and hence nutritional and exercise play a key role in its prevention and treatment. Nutraceutical interventions are currently being investigated on a large scale basis as a potential treatments for obesity and weight management. Nutraceuticals like conjugated linoleic acid, capsaicin, Momodica cerencia, and psyllium fibers possess potential anti-obese properties. Next one is the diabetes. Diet therapy is the basis for the management of gestational diabetes mellitus. Although there is widespread use of herbal dietary supplements that are believed to be benefit type. Second, diabetes mellitus. Few have been proven to do so in properly designed randomized trials. Isoflavones are phytoestrogens. They have a structural or functional similarities to human estrogen and have been consumed by humans worldwide. Of all phytoestrogens, soya isoflavones have been studied most. A high isoflavone intake is associated with lower incidence and mortality rate of type 2 diabetes, heart disease, osteoporosis, and certain cancers. Omega 3 fatty acids have been suggested to reduce glucose tolerance in patients inclined to diabetes. For the synthesis of the long chain N3 fatty acids, insulin is required. The heart may thus be particularly susceptible to their reduction in diabetes. Ethyl esters of N3 fatty acids may be potential beneficial in diabetic patients. Docosahexaenoic acid modulates insulin resistance and is also very important for neurovascular development. This is especially important in women with gestational diabetes mellitus, which foster the recommendation for essential fatty acid during pregnancy. Lipoic acid is a universal antioxidant now used in Germany for the treatment of diabetic neuropathy. It is possible that lipoic acid may be more effective as a long term dietary supplement aimed at the prophylactic protection of diabetics. Dietary fibers from psyllium have been used extensively both as pharmacological supplements, food ingredients in processed food to aid weight reduction for glucose control in diabetic patients and to reduce lipid level in hyperlipidemia. Magnesium status reduces diabetes risk and improves insulin sensitivity. Chromium, picolinate, calcium, and vitamin D emerge to promote insulin sensitivity and improve glycemic control in some diabetics. Extract of bitter melon and of cinnamon have the potential to treat and possibly prevent diabetes. However, it has been suggested that nutraceuticals with meaningful doses of combination may substantially prevent and presumably could be marketed. Other uses are cancer, immune boosters, and anti inflammatory agents, inflammatory disorders, osteoarthritis, allergy, degenerative diseases, macular degeneration, vision improving agents, Alzheimer's disease, Parkinson's disease, probiotics in health. Entering toxin reduction technology uses probiotic organisms to transform the colon into a blood cleansing agent which with the aid of microbes indirectly removes toxic wastes and helps eliminate them as fecal matter. Consequently, it is possible to maintain a healthy kidney function with the oral use of chemobiotics. The patented proprietary probiotics in chemobiotics have been clinically tested and shown to be safe, effective, and free of serious side effects when taken for as long as 6 months. Now, summary. Our discussed module will provide the information about current global trends in nutraceuticals, their types, raw materials, quality control and assurance, regulatory affairs and commerce in nutraceuticals, significance of nutraceuticals in the prevention and treatment of disease. We also discussed importance of nutraceuticals in various diseases, regulation aspects, nutraceuticals, etc. This is time for you for self study. We will meet again with another interesting episode in coming days. For more deep study, you all may refer the references given in this session. You may also visit to our website cec.nic.in for interesting facts, lectures, quizzes, frequently asked questions, and many more. Till then, goodbye and keep studying.